Hi, I'm Sarah Mitchell-Chen,
And I'm Dr. Jory Fleischer.
and we want to welcome you to Rush Recaps, a series of short educational videos to help address some of the most frequently asked questions we receive here in the clinic. We are generously funded by a grant from the Parkinson's Foundation to integrate primary palliative care into your day-to-day office visits. And so we're hoping that these will be a useful tool to help answer some of the growing questions that we often hear. So with that, Dr. Fleischer, I'm hoping that you could help answer the question of what the difference is between depression and apathy in this patient population.
It's such a great question. So we talk about depression and apathy in individuals living with Parkinson's disease dementia, dementia with Lewy bodies, sort of the whole spectrum, and all of the Parkinson's related conditions. And both depression and apathy are changes that are symptoms that occur due to chemical changes in the brain as a result of these conditions. And we can help manage both of them. So oftentimes we have families who will come in and say, I think my loved one with the condition is depressed. And it might be because they're seeing that their loved one looks less emotive, their facial expression is diminished, they're not talking as much, they're more withdrawn in conversation, they don't seem to have the oomph or the motivation to do things that they used to really enjoy. And so the way that we separate out these two things, let's start with apathy. Apathy is really a loss of motivation for things that one used to enjoy. And the way that I like to think about this is if you ask someone, hey, do you want to go to the movies? Right? The person might go, nah, I'm not really feeling like it, even though you know that they really enjoy going to the movies. But if instead you brought the movies to them, for example, say that you make a movie night at home, you turn things, you turn on a movie, you play it, the person really enjoys it. They're still able to find joy and pleasure in that hobby or that activity. That's apathy. It's almost like they're missing the motivation to take the step to do the thing. But if you bring the thing to them, they enjoy it, right? So do you want to go out to the kids or the grandkids softball game? No, maybe next time. But if you find a way and you can convince the person and you actually get them to the game, they're smiling, they're cheering, they're enjoying it, and they're glad that they went. That's apathy. On the flip side is depression, and people express feelings of depression in a whole host of different ways. So someone may say, I feel sad, I feel blue, I feel down, I feel hopeless or guilty or worthless. I think that things would be better, my family would be better if I wasn't around. I feel like I'm a burden. They may express those feelings. They may also just have less kind of energy, less motivation to do the things that they used to enjoy. And this can go, significantly to not sleeping at all or sleeping far too much, not eating at all or eating far too much or kind of purposeless activity, or just really slowing down kind of everything. And all the way at the end of the spectrum is having thoughts, not only just not wanting to be present and not wanting to be alive, but having active thoughts about wanting to take one's own life. Right. So that all falls under the spectrum of depression. And so often people look sad to someone else, but it's just apathy. We can find ways that they can still enjoy things. Taking those same analogies as before, if someone who's truly depressed, we make a movie night, they still may be kind of checked out and not able to really enjoy that movie, right? Or you bring them to the softball game, but they're not really engaged. They're still sad, they feel blue, and they, afterwards, did you enjoy it? Not really. I wish I would have stayed home, right? So there is this difference. And we have treatments for depression. So the research shows us that therapeutic counseling, so supportive counseling, seeing a therapist, a psychologist, at least for 12 weeks, having conversations with someone with whom you have a good relationship and you connect, that can be really powerful and really effective for treating depression. However, for many people, that's not enough. It's not sufficient, and we have medications that can help. And I think one of the biggest concerns about medications is I don't want to take something, I don't want to get hooked on something, I don't want it to turn me into someone I'm not. And like so much else that we do in treating people with Parkinson's and related disorders, we are trying to restore the chemical balance, not to someone else, but as close as we can to your normal baseline before disease, right? So we're not trying to turn you into some happy-go-lucky person if that's not who you were. We're trying to turn you back into you, or get you back to you so that you can feel like yourself. And the medicines that we have don't do this overnight. They take time. So if the expectation is, I'm going to take this pill and feel better tomorrow, we always want to reset that expectation and know that we didn't get to this point overnight. We won't get out of this feeling overnight. It will take time. On the flip side, if someone has apathy but is not depressed, they're not feeling sad, they're not feeling blue, they're not having any suicidal thoughts, they just don't feel like doing anything. Medicines are not typically the answer. The answer is a daily schedule where, even though their family might want them to do 15 things in a day, right? The person might want to do nothing in a day, that we agree to at least a couple of things each day. Kind of whether or not you want to, you're going to get up, you're going to shower and do your hygiene tests, you're going to do your exercises, and you're going to do something social that day, even if you're not feeling it. And on a good day, you'll do lots more. But an understanding that this is part of the disease, and just like you have to take your medicines or you have to do your therapy every day for it to really be effective, you have to stay engaged in order to keep the apathy at bay. So we hope that's helpful.
That is really helpful. Thank you, Dr. Fleischer.
Yeah, absolutely.
We hope that these educational videos are helpful. We're going to continue to be building more and more in our Rush Recaps series, and you can find all of these videos and other additional education on the Movement Disorders Patient Education page. If there are topics that we haven't covered, let your provider know, and we will be trying to continue to add to them. But with that, thank you so much for joining us today, and we'll see you soon. Take care.